Thank you, everybody, for being here today, doing the first of three webinar series. Today, we're going to be talking about Lyme testing and treatment. So it's a good afternoon or good morning, depending on where you're located. And I'm going to be presenting for about 30 to 40 minutes. And from there, I'm going to open it up with Q&A. Now, we're going to go through a lot of content. I do know people are all at different places when it comes to Lyme disease. One of the important things to me when we begin is why it's important, even if it's something that you might be nervous about going into in terms of the knowledge of reading labs, interpreting labs, and treatment. Really important to have at least a base understanding so you can, depending on where you're at, either interested in specializing and focusing in it, or to at least feel comfortable with the workup and assessment and starting to make some strides there for your patient. So let me just share my screen. Okay, so Lexi gave my really long bio, naturopathic physician, also Amazon bestselling author ×3, past president of the ANEP, and also on the board for American Academy of Environmental Medicine. So why is this important? So on average, people see about 7 to 9 doctors before getting treated or worked up diagnosed for Lyme disease. And especially if they're coming to see you by way of integrative medicine, functional medicine, likely they may have seen even more than that. One of the reasons the symptoms are very nebulous. And so, especially for women, which we're going to speak a little bit into based on other things that might be going on. But why it's important is that we don't want it to be 10 doctors before they're getting diagnosed appropriately. Also, if you look at the rates of infections, they've quadrupled yearly. So infections have increased outside of Lyme disease. We see a much higher increase of infections and autoimmunity, particularly after 2020. So this is hugely important. And many of the patients and people will be coming to see you because their needs may have not been met in the conventional setting based on the symptoms they might be presenting with and because of the faulty labs. When we look at labs, which we're going to go into, almost 50% of labs through the conventional labs are actually false negative. So that's another reason why someone can actually have the clinical symptoms, but not actually present positive in the testing. So what are we going to go through? We're going to go through clinical manifestations. We're going to go into Lyme disease specifically. Today, the other 2 webinar series are going to be on Bartonella and Babesia. And we are going to go through touch upon conventional treatments as well as integrative treatments. I'm a naturopathic physician, so of course I'm going to focus more on that. But I did want to mention some of the antibiotics that are typically recommended and also go into a little bit of what could be some of the issues with some of the antibiotics as it pertains to Lyme disease and what to do to augment that. So first thing, about 500,000 people are diagnosed every year. A lot of people feel that's not a high amount, but when you look at other like IBDs like Crohn's or ulcerative colitis or things like TB, it's around the same number, about 600 to 800,000 a year. We also think that diagnosis number is actually not accurate because, as I mentioned, most people are seeing many doctors before they're getting diagnosed. So if that's happening, other people might be out there that actually have Lyme disease and do not even know that they have it. So we definitely estimate that number to be a lot higher than what is currently, because that's what's currently reported. Also, warming climate. So warming climate has increased emergence. Lyme population has doubled since 1991. Number of new infections, as I mentioned, each year has quadrupled, with yearly outbreaks tripling. And also, typical transmission is usually 36 to 48 hours, but things like Powassan virus can transmit as quick as 15 minutes. Why is that important to know? It's important to note because many either providers or patients will say, hey, I went out hiking. I was only out for an hour or 2. I found a tick on me. I can't possibly have it. That's actually not true. What's ideal is if you can actually send out the tick for testing, but it is possible, depending on the species, that can actually transmit a lot faster than what is expected. So it was discovered in 1975, children in Lyme, Connecticut, getting diagnosed with juvenile arthritis. A rheumatologist at Yale began treating them with antibiotics and they began getting well. And Willie Bergdorferi, who actually found Rocky Mountain spotted fever, actually came, tested it, and they then named it after him, Borrelia burgdorferi. So some of the things to know about Lyme disease, it's often called the great imitator. And the reason is because it mimics a lot of different conditions, including things like rheumatoid arthritis, MS, fibromyalgia, chronic fatigue syndrome. When you look at things like MS, individuals with Lyme disease can have plaques on their brain in an MRI, just like you can have with MS. They can have coordination issues, neuro issues. So all of those symptoms can present and look very similar to Lyme disease. The other thing is many people, even after getting treated, which is called post-treatment Lyme disease, which they refer to as PTLD, about 30% of individuals will continue having symptoms after treatment. So this is after treatment with antibiotics. Typically, the symptoms are arthritic, where they're presenting like rheumatoid arthritis. Also, I've even seen clinically where someone may get diagnosed with rheumatoid arthritis, the RF factor is elevated. I see them for Lyme disease. They get treated for Lyme disease. The rheumatoid factor either goes down or clears completely. So that's another factor to look at when you have patients with autoimmune or arthritic conditions. Can Lyme disease or another tick-borne disease be a factor in it? So it's primarily from the Ixodes family, Ixodes scapularis on the East Coast, Ixodes pacificus for West Coast. Also important to note that, and I'll show you the map later, throughout the country, but there's different subspecies depending on the location where somebody's at. And this is why you want to make sure the lab vendor that you're using is looking at many different subspecies, not just Borrelia burgdorferi B31. And it also can be found in body for months, especially in round body form. And some actually antibiotics, particularly doxycycline and amoxicillin, when treating, can actually put that spirochete into round body or stationary form and also cause an issue with things like biofilm. So you want to make sure to be mindful of that, especially if someone has been on antibiotics for a long time for treatment with Lyme disease. As I mentioned, known as the great imitator, can occur year round. There's diagnosis of Lyme disease every single day, but more common May to July because of the fact that that's the reproduction cycle. I think I just have my message. I just want to make sure sound wise we're okay. Okay, sorry. I just wanted to make sure there wasn't any issue with the sound I'm having. Sorry, guys, I couldn't see. One second. Okay, I'm going to go back. Some reason my cursor was hiding when I was trying to like close out the box. Okay. So reproduce again more in the spring, May to July, but you can find it year round. I have many patients that come from New York City. They don't think that that's possible to get it, but definitely have been diagnosed. And sometimes like in the wintertime, people assume that they can't get it then, or they can only get it in the summertime. Again, not true. So 4 main species, and those include Borrelia burgdorferi, Borrelia myomete, which is also tick-borne relapsing fever, most common in the USA. Borrelia afzelii and Borrelia guarinei is most common in Europe and Asia. You'll also see afzelii common on the West Coast. And sometimes you'll see, I've had many patients that have went to the Caribbean or have went to Mexico, and they come back saying that they maybe were bitten, not sure. And they have symptoms of Lyme disease, and we test them and they're positive too. So also that's also a red flag with traveling if you notice some symptoms. This is a great map by Agenics that shows the spread of all the tick-borne diseases throughout the country. And my point of having this was just to emphasize all the locations, obviously more dense for Lyme disease in the east, on the northeast. However, you see that most tick-borne diseases are present in all 50 states. And people also travel and can contract disease in other countries or states too. So you want to definitely ask the patients that question, what their travel situation is, pets, et cetera, all those kind of questions that could also cause them to be exposed. Tick population, as I said, is continuing to grow. So typical, what you'll see is a bullseye rash, and what's called erythema migrans, and it can take anywhere from 3 days to 30 days. Typically, it's 7 days. Many times you could have multiple bullseye rashes too. I've seen that in people. I've even seen more bullseye rashes come up even with treatment. It can spread as big as 12 inches. One of the things is it's typically warm and not itchy like a hive. And also, just to note, many people don't have the bullseye rash. So that's another thing people think you have to give the bullseye rash. And the bullseye rash can present differently. It can look almost like a spider bite. It can present different on different skin tones, etc. So many, again, this is what the note is, many don't present. So if you look at here, this is the erythema migrans, different forms. The bottom here in the middle is a typical bullseye rash. But many people, like myself, I had Lyme disease, Bartonella, and Babesia. Mine looked more like this, which people would typically think is like a spider bite. So this is just to show how it can present differently, not necessarily in the typical bullseye rash people are used to, but also like these kind of blue-red lesions or this, which can look more just like a regular bite. So close to 50% have a bullseye rash, meaning, 40 to 50% don't. So that's another thing where I had patients that are turned away saying you don't have a bullseye rash, therefore you can't have it. That's not true. One of the other things to know is important not to test immediately if they look like they have a spider bite or a bullseye rash, because outside of the T-spot testing, your antibodies might take 3 or 4 weeks at least before it's showing in blood work. So oftentimes we'll do treatment prophylactically, or you might want to put them on like kind of a herbal formula immediately and wait to do testing, because doing it early on will likely be negative because their antibodies have not had a chance to show in the blood work. Other things, muscle pain, body aches, fatigue, headaches, swollen lymph nodes, Bell's palsy. I've had patients with Bell's palsy, racing heart, palpitations, blurred vision, seizures when it's starting to progress, more neurological symptoms. And we're going to talk more about neurosymptoms, psychological symptoms that can present more so with Bartonella and Babesia, is possible with Lyme disease as well. But you can see things like seizures, which I've had with some of my patients, ocular issues, something called ocular convergence is common, tremors, as well as, blurred vision and floaters. And then some people have what I mentioned is chronic Lyme arthritis. So about 20 to 30% of people can actually have continued, again, Lyme symptoms. Lyme arthritis is the most common, affecting the large joints like the knees and the hips after treatment. So I wanted to also mention quickly the demographic differences. So the presentation, again, of the erythema migrans rash might present different on different skin tones. So if you see here on the left, looks completely different than the bullseye rash. And one of the reasons why individuals that have any pigmentation or color may also take even longer than, like I said, the 7 to 9 doctors before they get treated, and unfortunately can manifest into having more neurological symptoms because it was not seen physically. Again, here's just talking about 34% of people of color, neurological signs of Lyme disease as compared to 9%. That very much is likely due to the fact that it's a late diagnosis. The other thing, demographic consideration. So as I mentioned, the symptoms are really nebulous, even more so for women, because if there's things like PMS symptoms or perimenopause, or let's say after pregnancy, many of the symptoms can seem hormonal, including things like brain fog, forgetfulness, which can also be hormones, insomnia, anxiety, headaches, palpitations. Those are all symptoms that can be seen hormonally. And also if somebody just has mental health issues like anxiety. Also, diagnostic testing, as I mentioned, about 50% of individuals have, like, they might not test through conventional labs positive. And more men than women also test positive for Lyme. In the studies they've shown, men will show on often 6 bands, women will have 4 bands. And for things like IgG, you have to have 5 bands to be positive. So not having a high enough antibody count, meaning many women may be missed. Hormone transitions make it worse, especially perimenopause, menopause. As we know with hormones, they can influence inflammation, estrogen being more pro-inflammatory, testosterone being more anti-inflammatory. And so those changes can also make the symptoms worse. There's also a whole issue with inflammation as a role, and we'll talk a little bit about that. But there's different standards by way of infections, molecular mimicry, bystander activation, epitope spreading. All of these can also induce potentially an autoimmune condition if the infections are not managed. And about individuals with autoimmune conditions often have at least two chronic and persistent infections like Lyme disease, like EBV, like mycoplasma, that have not been managed, which can also trigger up an autoimmune condition. So 60% of untreated patients develop arthritis that can last for several years with Borrelia burgdorferi, so 60%. the Borrelia burgdorferi surface protein develops in 70% of patients that have antibiotic-resistant Lyme arthritis. And some research has even shown that Borrelia burgdorferi can trigger development of autoimmune conditions like RA, MS, or SLE, particularly if someone has a genetic predisposition where there's a family history, much more likely to cause an issue and also lead to other conditions. Also, if you look at, blood-brain barrier disruption, it can also cause infections, can lead to significant systemic inflammation, which creates greater permeability with the blood-brain barrier. That increases signal changes, cellular traffic, and you have direct damage to the brain. You'll have the endothelium get expressed greater. So you have these inflammatory mediators like IL-6, IL-1 beta, TNF that can also increase up, which causes more inflammation to the brain, which can cause mental effects. And this activation of what's called microglia also is a hallmark of brain pathology. And that can increase from things like Lyme disease, Bartonella, Babesia, which help to the microglia help as macrophages to help mediate neuroinflammation. So when these are constantly activated with chronicity due to infections, you'll have this effect on neurotransmitters like the GABA and glutamate relationship, an altered GABA and glutamate relationship, a change in dopamine. You'll see changes in things like IL-10, which helps with increasing or supporting dopamine. And those get impacted for things like depression as well as schizophrenia. And then you have these inflammatory cytokines below here that also can negatively affect the brain, causing neuroinflammation. Also, infections outside of Lyme disease, as I mentioned, tick-borne diseases support symptoms of significant anxiety, according to studies, and depression months and years post-treatment. Also, other viruses to look at, things like COVID-19, of course, HSV, HIV/AIDS, especially when it comes to neurodegenerative conditions like Alzheimer's and Parkinson's, PANS and PANDAS. And then we've even shown parasites and like Taenia sodium and Toxoplasma gondii have been connected with things like schizophrenia. Okay, so now what are some of the laboratory tests we're going to do? Because that's our focus for today. Because what I just talked about could be 4 hours of presentation in itself talking on neuroinflammation. So laboratory tests, the common standard is IgM 2 bands, meaning typically infection in like less than 3 months, typically IgG, 5 positive bands. But just to know, and I always remind everyone, per CDC, it's a clinical diagnosis because, as I mentioned, many people don't get the bullseye rash. Many people in the conventional labs do not show positive. So you still need to base it on clinical findings. As a test, or not ELISA, Western blot, much more accurate than the ELISA test. If you can't do it through a specialty Lyme lab vendor, definitely at minimum the Western blot. And as I mentioned, testing for Lyme disease immediately after seeing a bullseye rash will likely produce a false negative. And that's when you want to look at things like T-spot testing, because testing for the T helper cells, that's going to go up earlier than what you're seeing in like an immunoblot or a Western blot. So most tests that you're going to be looking at are going to test for B. burgdorferi B31. And that's one of the issues. And what you want to do is make sure you're having a test that's high sensitivity and high specificity. So if you look at Igenix is one of the common labs that do. I know there are many different labs that also have immunoblots and other testing types, but there's different tests, and we call them what's called direct testing and indirect testing. So indirect testing, they're actually looking for the antibodies to the bacteria or parasites. So looking for the antibodies. That would be in a Western blot, immunoblot, immunofluorescence, and then IgX spot test, which is the T-spot test. So, but one of the challenges when you're doing indirect testing, about 15% of people do not produce enough antibodies, so they might not show positive for the indirect test. So if you suspect someone has Lyme disease, but they're not showing positive, you might want to do what's called direct testing. And what direct testing looks for bacteria or parasite in the blood itself. So that's testing with PCR testing, real-time testing, fish, and then culture. So oftentimes you'll look at both of them. And when you're looking at the standard test, like Western blot here on the top, B31, it's only testing for one thing, versus if you look at some of these other specialty labs like Igenix, they're testing for 8 different species, right? So they're testing for way more. And that is why the tests are likely to be not only more accurate, but you're going to have also more findings because things are going to get missed if you're only testing for B31. Also with Immunospot, they have recombinant proteins as the test antigens and they're not proteins from cultures of lab strains. And you see here on the right side, they're testing for basically a precise amount is sprayed directly into the membrane at specific locations. So it's greater specificity because the quantity and location are actually controlled. I don't know why the font's a little bit smaller for here. It didn't look like that on my actual test, but EBV, one of the others. So you want to look at other tests. So HSCRP, NCRP. You want to look at IL-6. Other laboratory tests you want to look at. You want to look at EBV, particularly early antigen, because a lot of people just do IgM and IgG. So these are other tests you want to look at. Adrenal, thyroid hormone, and neurotransmitters, and also environmental triggers. So some of the environmental triggers you want to look at are things like mycotoxin tests. So a lot of individuals that have Lyme disease may also have sensitivity with mycotoxins. So you might want to look at things like, especially I'll see like ochratoxin, aflatoxin, et cetera. So you want to definitely talk to patients about any moves, recent exposures. Typically with mold, you'll see more brain fog. You'll see more immune dysregulation where they're getting sick a lot more often. You'll see more allergies, sinus congestion. You'll see headaches. Sometimes you'll have like water retention, which I see. And sometimes when I treat people with mold, you'll see weight loss as a result when you treat mold. But that is often commonly with Lyme. So you also want to look at mold as part of it. But sometimes it's tricky of finding what is more of the issue versus the other. And so that's when the history and the intake is really helpful to get to that piece. As I mentioned, CRP is one you want to check out. These are some inflammatory biomarkers that can also go up, IL-6, IL-10, CRP. These are also indicators if there's like inflammation where there's mental effects. Okay. So these are common. I wanted to talk about some treatments. Now we're going to talk about integrative treatments, and we will also talk about conventional labs. So these are herbs that have been heavily studied through PubMed, the ones most commonly known. So Cryptolepis sanguinolenta is one, and that is one. Cryptolepis as well as Artemisia and Uncaria tomentosa. Those 3 have been studied helpful for Borrelia and also have been studied helpful for any kind of like autoimmune conditions like rheumatoid arthritis. So this is a great thing to couple if you have patients that also might have an autoimmune condition or immune dysregulation. Juglans nigra, you have black walnut, you have Polygonum clipstidatum, which is Japanese knotweed. As I mentioned, Artemisia, Uncaria tomentosa, which is known as cat's claw, Cistus, and Scutellaria bicalensis. Scutellaria bicalensis, more specifically, not laterifolia. Those have been studied to show it as effective as some antibiotics like doxycycline, and also against growing and non-growing forms of Borrelia burgdorferi. So this is great for individuals that have stealth infections, persistent Lyme, because it's helping with both the round body and the stationary forms. So this is just more detailed information about the herbs itself. So you see Borrelia burgdorferi has been studied with Cryptolepis. They use it also as an antimalarial and compared against chloroquine treatments, and also has other benefits of being anti-inflammatory, antifungal, antipyrexic as well. Artemisia, as I mentioned, especially if a person is having memory impairment, brain fog, short-term memory issues, has been studied to be helpful as compared to antibiotics in patients with Lyme. Also studied for things like Babesia, which we're going to be talking about in the 3rd webinar. And usually the dosage is a little lower, about 300 to 400 milligrams total in the day. That one is also considered an anti-helminth. So I sometimes see people when we put them on Artemisia that they'll have some stool changes, or it might also help with things like parasites. So if there's also gut issues, Artemisia is a great one to consider. Scutellaria bicalensis, that's also has been studied and has shown to support a healthy inflammatory response and also helping with antimicrobial activity. This is what I said. I don't know why it's making it funky for some reason. So Japanese knotweed helps as an antimicrobial. It's been studied against log phase spirochetes and stationary phase of Borrelia burgdorferi. Has what's called resveratrol in it, which, as we know, helps with cardiovascular support. And that can also be helpful if someone is also having cardiac issues like palpitations, things like that, or have any cardiovascular issues at all. And it's also Japanese knotweed is helpful against dormant persister forms that withstand long-term antibiotics as well. So as I mentioned, so that one is great. Japanese knotweed, especially for round body forms or individuals that have suffered from it for a long time. Now we have cat's claw. As I mentioned, cat's claw is also been studied as anti-inflammatory, also for autoimmune conditions and as an antimicrobial. This one you have to be careful if someone is on like something that it does inhibit some of the cytochrome P450. So if they're on specific medications, you have to be mindful of it actually decreasing its effectiveness. So this is one to kind of to look out for that reason. Andrographis. So andrographis is another herb heavily studied to help with Borrelia. Also, it's great for the lungs and respiratory function. So if there's things like walking pneumonia, that's a great one to look at too, and also helps to modulate the immune function. Stevia. So stevia has been studied, helps also with round body forms, spirochetes, biofilms. Lyme and a lot of these persister or stealth infections produce a lot of what's called biofilm. And so things like stevia, things like oregano can help against it. And also the great thing with things like stevia, it also helps normalize cytokines like IL-6 and TNF alpha, as well as IL-1 beta and NF-kappa B. And these are all ones I mentioned also with neuroinflammation. So this is a great one to couple if you're having a patient that also has mental health effects with Lyme disease, and we're actually helping with that. Plus, we're also helping to downregulate those inflammatory mediators that are also most connected. So as I mentioned with biofilm, what is biofilm? So what biofilm is it contains types of bacteria, including could be Borrelia, other bacteria, other viruses, fibrin-based proteins, and also what's called mucopolysaccharide sugar that provides structure that actually holds the biofilm together. So what you need, so it protects the spirochete, allows these spirochetes to hide or bacteria to hide from the host, right? And so you need something that's actually going to break down fibrin-based proteins that actually hold biofilm together. Things like nattokinase, lumbrokinase, these are all helpful. Stevia, as I mentioned, has also been studied, and oregano. Now, I just wanted to discuss some of very quickly, again, each one of these could be lectures on its own, but some of the most common known integrative protocols to look at if you're looking to work with patients with Lyme disease. So one is called Buhner's protocol. This includes many of the herbs I just mentioned that have been studied: Japanese knotweed, cat's claw, andrographis, particularly as a core protocol. They also look at adding things like Siberian ginseng and astragalus. Stephania root and Artemisia, again, is also looked at for things like Babesia. The other common, so Buhner protocol is one. Another common protocol, Cowden's protocol. Cowden typically is 14 different products that alternate. I use what's called the modified Cowden protocol in our office, and it's focused on eliminating spirochetes, round body forms, biofilm. And there has been one study. Dr. Horowitz is a very known Lyme literate doctor, had a clinical study that showed 70 to 80% effectiveness in advanced Lyme cases by 6 months. Normally, the protocol is a series of about like 7 to 9 herbs that get alternated every 4 to 6 weeks over the course of about a year. There's definitely times at which it gets like pulsed or stopped. And the drop count is typically 15 to 45 drops twice a day. And some of the common ones I just put that we use here in the office that we've had a lot of good clinical effectiveness, I listed here: Cemento, Banderol. Those two were the two herbs that were studied in Dr. Horowitz's protocol, Cemento and Banderol, that has shown to be as effective, if not more effective, than doxycycline. Important when you have any, as a note with anybody detoxing or herbs, et cetera, that they're also on some type, like drinking plenty of fluid to help make sure that they're detoxing things well. Other known formula products, so I talked about Buhner protocol, I talked about Cowden protocol, Byron White. Byron White is 40 formulas, help to treat infection, support immune function, detoxification, and grape alcohol. Typically, the drops are much lower, not a specific protocol like you'll see with like Cowden, but typically it's around 5 to 10 drops twice per day. And then we also have things like Beyond Balance. So Beyond Balance is great because they're in glycerate, so used sometimes with kids. Highly concentrated, non-specific, again, 40 products. and generally a little bit of a lower dosage, about 2 to 15 drops twice a day. So one of the things that's important is also you're supporting a Herxheimer response. So a Herxheimer response is when these spirochetes from the treatment of these antimicrobials or antibiotics can cause this die-off. And so you need to help aid people with that die-off experience. And so things like that are going to help neutralize acid, like Alka-Seltzer Gold is a great one, trisalts or any kind of like electrolytes that have carbonates in it. Turmeric also downregulates IL-6. Things like Boswellia, quercetin, which blocks both the COX and LOX pathways. These are all helpful if a patient after treatment is having a Herxheimer response. These are other treatments integratively that people look at, things like low-dose immunotherapy, helps with immune tolerance. They're basically isopathy and helps with molecular mimicry and balancing of that. So those are the primary ones we look at for integrative medicine. Now, when we look at conventional, typically the treatment for Lyme is doxy, tetracycline, amoxicillin, azithromycin, cefuroxime, or rifampin. And then we're looking at kind of multiple antibiotics when we're looking at the other infections, which we'll talk more about in the subsequent webinars. These are also other common antivirals that your patient might be put on as well if they're dealing with that with Lyme disease. Another common thing people are often put on is LDN. So LDN is opioid antagonist used for Lyme and also other autoimmune conditions. So perfect if someone has Lyme plus autoimmune conditions, typically going up to 1 to 4.5 milligrams, as high as 6.5 sometimes for people, can impact sleep. So you have to just kind of look at that when someone is first getting treated. IVIG. So IVIG is often common to use as well. I've seen more commonly with kids that also have PANS and PANDAS. And helps with antibodies for deficiencies. Infusion therapy is typically monthly, and the treatment is about every 3 to 4 hours. These are some other treatments. So I just put it in here. So I often get asked about that. HFOT, typically it's lower pressure for about 1.3 to 1.5, shown to help reduce inflammation, help improve cognitive function, also mitochondrial function. So with Lyme disease, the mitochondria is impacted pretty significantly. Ozone therapy is another one used pretty commonly, which helps to generate oxidative damage, which is then toxic to the bacteria and viruses to survive. Sauna. So sauna is another thing we love in our office within limitations, because sometimes people with sauna past 30 minutes will be aggravated. And also if they have mold, this is a great way to eliminate toxins. And SOT. So SO2 is another one that usually gets involved later because it's pretty expensive, which utilizes short DNA or RNA to block expression of critical segments of genes needed for Lyme and co-infections. And then some of the other treatments and more advanced treatments are things like hyperthermia, and done usually in other countries, amino acids, peptides, and stem cell therapy. So you also want to make sure you're supporting the immune function. So vitamin D is really important. Monolaurin, arabinogalactin. Vitamin D is expressed on B cells, T cells, and antigen-presenting cells. Also, things like I said, if someone is having more mental effects with Lyme, you want to look at things like berberine, which helps with the suppressing of activation of NF-kappa B, and inhibits LPS-induced tissue factor activity. Like I said, I don't know why it keeps going weird with like some font small. So oregano, again, is great for biofilm, antifungal, especially if someone is on antibiotics. Many of the antibiotics are yeast forming, so you want to make sure they're on, let's say, a probiotic that has Saccharomyces in it, or things like oregano. These are also some other anti-inflammatories that also help with mood support. Turmeric helps with CRP and IL-6. Flavonoids, ginger also not only helps with pain, but also helps have a favorable profile for serotonin levels. If you look at things like Scutellaria latifolia, we mentioned Scutellaria bicalensis before, helps with memory and focus if that's an issue for your patients. And NAC also helps with OCD, helps with oxidative stress, omega-3, again, with CRP levels, and also CBD, helping to not only help with mental impacts, but also helping with COX-1 and COX-2. The other thing is just very important to note for your patients, if you're working with anybody that has high risk for Lyme disease, high risk population, farmers, gardeners, those are those people that are outside, making sure that you're working with them on prevention strategies. So what do prevention strategies look like? Making sure they're wearing, long sleeves, white clothing when they go outside, checking their body putting clothes in the dryer. If you actually dry clothes for 6 to 10 minutes upon coming in the house in high heat, that helps. Also, if somebody's outside a lot, you can also treat things like shoes. So there's a permethrin treatment. You guys can check out like Insect Shield. And so some people just treat the shoes, and especially people that are outside, like avid hikers or hunters. They're 73 in the studies times less likely to get a tick bite when they're treated compared to untreated rather. Insect Shield also has things like 70 washes. So people use that in the spring and summer months to help prevent the rate of tick bites. And then also cedar oil. So cedar oil has been studied to be as effective as DEET. Pickardin, we use Pickardin pretty commonly in our office, commonly used in Europe, and it's EPA registered, and it shows equivalent also protection against things like DEET. Again, so I said, make sure being mindful of covering clothes. Ticks will usually burrow in areas like head, groin, underarms, waist, belly, etc., and being mindful of those areas, particularly in the times of reproduction, sending out the tick if you can. And also as a reminder, if you are treating somebody, especially with antibiotics, making sure it's long enough time, that it's at least 14 days because of the replication cycle being 12 days. You want to make sure it's at least thorough enough that it's covering that time frame. So that's it for me. I'm going to leave it open now for Q&A. This is how to connect with me. I do have a book called Women and Lyme. Also pretty active on Instagram, naturopathic physician. And I also have some other references to email me with any other specific questions, and we will take it from there.
Welcome to Rupa Health, the best place to order, manage, and track results from over 30 different lab companies in one single place for free. It's going to take you under 2 minutes to sign up, and you can order any functional medicine lab for your client in under 30 seconds. Let me show you how it's done. So here's our beautiful interface. I'm typing in the name of my client, selecting the lab that I want to order for them, and hitting send. From there, Rupa and their amazing team handle the rest. They email the client, collect payment, and even offer an interest-free 3-month payment plan. We've also built the world's largest library of information about chronic health conditions, the lab tests that can help you find the root cause, and the evidence-based interventions that you can use to help people heal from them. It's called the Rupa Health Magazine. There, we have in-depth articles about almost any health condition you can imagine. And we give you step-by-step protocols that other clinicians have used to help their clients heal and that are verified by evidence-based sources. You should totally check it out, and it'll transform your practice. And we can't wait to see you. So make sure you sign up today at rupahealth.com.